Welcome to the 707, a weekly half-hour program produced by KRCB, a service of NorCal Public Media. The 707 features voices and stories from your community, stories that explore our nonprofit sector, and stories that show how we are connected to each other. I'm your host, Michelle Marques. One of the first episodes of the 707 featured a visit to the Redwood Empire Food Bank in November 2024 on a busy day where hundreds of volunteers came together for a Super Saturday, concentrating efforts to bring in and sort donations. That spirit continues. However, the political climate has changed drastically since that day, and the volume of food and financial support has also been slashed due to changes in federal policies. I recently toured the food bank with REFB President and CEO Allison Goodwin and Congressman Mike Thompson, who represents California's 4th District.
The work you do is phenomenal, and you guys have been doing it for a long time. You've fed a lot of people, you've helped a lot of families, you've helped our community, and the fact of the matter is, in the United States of America, no one should go hungry. So thank you for your commitment.
Absolutely, and we agree. So we're serving about 142,000 people now through our territory of Sonoma Lake, Mendocino, Humboldt, and Del Norte counties, and knowing that there's a lot more need out there, and it's likely to continue to grow just based upon the fact that the landscape is changing, and there are other programs that are likely going to be impacted in the next couple of years, and so we want to be here for the community as they, turn to us for help when other safety net services are at risk.
Goodwin says that changes to SNAP, the Supplemental Nutrition Assistance Program, impacted food banks earlier this year.
So we saw immediate impacts even back in the spring. So prior to the recent legislation, there were canceled truckloads of food. So we already had 7 truckloads of food. It was about $750,000 worth of frozen protein and milk and eggs and things like that we went, oh golly, okay, well we can't just make up the difference, at the drop of a dime and purchase those goods. And so really we've changed our whole provision of help of what people have really relied upon us for. So instead of milk and eggs and protein at every touch, we're saying, gosh, we still have the bounty of fresh produce that we've ever had, and we do have some shelf-stable items, but we're trying to leverage as much as we can in, donated protein, because we can't just turn around and, write a check for what the difference would have been that we would have gotten in USDA commodities.
And I know, Congressman, you've had a chance to volunteer here. What was that like?
I have. It was pretty fantastic. I've done it at a couple of different food banks throughout our current district and other districts that I've represented, and it's fantastic. People come out, there's camaraderie, everybody's here for the right reason, and that's to help people, help feed people, and there's a good sense of accomplishment and a good sense of good that people bring and take away from the experience.
Have you heard from people who have come to pick up food at the food bank?
Oh, yeah. Yeah, and I've heard from a lot of folks, and right now budgets are stretched, prices are up, inflation is impacting family budgets, especially at the grocery store. The food programs that are in partnership with local agriculture have been impacted, so farmers who are able to supply certain goods to schools and other venues have lost that ability now, so it's hurting the agricultural community, it's hurting schools, it's hurting seniors, it's hurting veterans, it's hurting our community.
And you've had that opportunity to buy produce, right, from local farms. Has that been impacted?
Yes, so that was part of USDA funding cuts as well. So we no longer have the local food procurement program, and that was our way of sourcing super hyper local produce and handing that out to the community. We do still partner, obviously, with local entities as much as possible in getting local produce out to people here in Sonoma County, but without the funding support that we were having. That really was the foundation for infrastructure for those farmers. And so it was a way to say, gosh, they need to be sustainable too. We can't just look to them to donate food to their local community. How do we keep them whole and employed and, sort of above water, as it turns out?
So Governor Newsom did sign into our California budget, I think $60 million for Cal Food. Does that make any difference for buying local produce?
It does. So it's what we've been asking for annually for the last couple of years, and thankfully the legislator said yes, and so that is that's a tremendous help to us. It doesn't it doesn't replace the other LFPA that was lost. So we've been relying upon the state of California to provide Cal Food for 4 years already. But it is, you're absolutely right. It's using California dollars to source California product for food banks. So we traditionally have leveraged eggs because it's a really culturally relevant, easy thing for us to get in the quantities and case products. So from a complex logistical system that we also are, that was a really easy, accessible product. We will likely continue to source products like that because that's what the community would really like from us. So not only are we, gleaning produce and getting that out, we have the kitchen, which Chef Dawn helps to create meals that are on the spot. And so the idea of that is to feed the line. So as people come for groceries, they also are able to eat right in that moment. The goal is, because we have walk-up and drive-through distributions, the goal is that it's really something that's easy, like a wrap, or something that they don't need a bunch of utensils and is not complicated to eat while they're on the go.
We take a walk into the community kitchen where Chef Don Nolan is working with volunteers to create quick, easy-to-eat meals for people who come to distribution sites to get food. Goodwin says the Redwood Empire Food Bank calls these meals on-the-spot nutrition, and Chef Nolan is able to use donated food that might otherwise be hard to distribute.
So he can take a 50-pound bag of hemp flour and make cheesy biscuits, or large stalks of kale that an individual might say, oh golly, how am I supposed to prepare this? And he can turn that into something really magical that they can eat in the moment. So lots of frittatas, lots of wraps, things like that are really healthy and nutritious, but easy for somebody to eat.
Volunteers are using produce from Farm to Fight Hunger in Healdsburg, including zucchini, which they have pickled, as well as celery, onions, and tomatoes. Congressman Thompson asked the kitchen volunteers to tell us where they're from and why they volunteer at the food bank.
And I live in Santa Rosa, and I do this because I want to do community service, and this is really fun.
I'm Jennifer from Santa Rosa. I learned about the food bank when my son was in Boy Scouts and used to work at the food bank each week. And so when I had time, when they got older, this is what I wanted to do.
I'm Braden. I'm from Runner Park, and I do this for the experience of cooking.
I'm Jody. I live in Petaluma, and I just like volunteering at the food bank because giving back to the community is very important to me.
Kathy from Sebastopol, 3,000 hours in 7 years.
Hi, my name's Walt. I live here in Santa Rosa and retired, and I thought this is just a great way to spend some of my week helping others. I like working here. I think my wife also likes to see me drive away.
Goodwin takes us out to the distribution center where workers driving forklifts are zipping back and forth, moving pallets of food around the floor, preparing them to be loaded onto trucks, which will take them to various locations around the region. We put on safety vests while Goodwin explains the logistics it takes to keep food moving in and out of the center.
Honestly, we can't do what we do without partnerships. So we have 130 faith-based and nonprofit partners that it can look in a variety of different ways. So that can be schools, that can be childcare, that can be higher education, it can be completely faith-based partners that just have a pantry or the occasional drop-by if you need something. It can be a full-on food pantry that operates multiple days a week, multiple hours a day. We don't tell them how to do it. We just say, gosh, if you're helping people in need that are turning to you for food or meals, come be a partner of ours and help us make an impact. Some of them get deliveries from us. Some of them shop in our actual on-site community market. And then others get, delivery. So if they're getting large quantities, we're saying let's get you on a schedule every Tuesday to drop off. They order online, they come here in person. We're sort of like the Costco of hunger relief. So you got to get it while it's fast. Come and get it while we have it because it's super dynamic. What we have coming in every day, we're getting out the very next day.
So what's the process of letting everybody know what you have? Because it changes all the time, right?
Yes. So partners can look online. We have an online ordering system. So the bounty of produce is really easy. They would go on and say, great, I want a couple 100 pounds of this or a couple 100 pounds of that. For the odds and ends, that's where they might choose to come into the market. So if they say, gosh, we know we have clients that are gluten-free, or we know that we serve a certain population that really likes these condiments or sauces or or umami, whatever it is that they're shopping for, they like to do that in person. So we can walk through the market and you can see what that looks like, but it really allows volunteers from their organizations to come in and be thinking about client choice as they come get food from us. But if it's anything that's cased, if they say, gosh, we always want peanut butter on hand, we always want rice, we always want beans, then that's the type of stuff they would order online.
Goodwin takes us through a corridor that leads outside of the building to another resource for partner organizations. So where are we headed next?
We will head to the Food Connections Market. So this is where our partner organizations shop. It allows them, they make appointments to come in, so they get their own, somewhat intimate shopping experience. They don't have to crawl all over each other to get the last of something. And this is where they come to fulfill whatever it is their needs are. A lot of partners shop once a week, sometimes twice a week, just to make sure that they can get through, whatever their typical provision looks like. Yeah, so we always have the same kind of replica of Bounty, so we would always have fresh produce available in here for, again, them to add, to grab whatever they want. Oftentimes this is product that's not necessarily cased, so we might not have enough of it to put on a complete order. It's a way for them to come in and get odds and ends. So if we have a Clover Sonoma donation that's assorted dairy, then they might come in and just grab what they need.
In the next segment of the 707, I sit down with Goodwin and Congressman Thompson to talk more about policy and how it's impacting food security. This is KRCB.
I'm Corva Coleman from NPR News with a little something to kickstart your mornings. Sonoma First News is a weekday morning podcast with the top local stories and weather updates from across Sonoma County. From Petaluma to Bodega Bay, Sonoma First News has you covered. Subscribe now through KRCB's website, on the NorCal mobile app, or wherever you get your podcasts. Sonoma First News from Sonoma County's NPR station, KRCB FM.
Welcome back to the 707 on KRCB. I'm your host, Michelle Marques. I'm sitting down with Allison Goodwin, President and CEO of Redwood Empire Food Bank in her office, along with Congressman Mike Thompson, who represents the 4th Congressional District, to talk about the impact of federal policy on food security and what legislators fought for.
Well, we did a number of things. I say we because it was a pretty unified effort on the part of the Democrats. We certainly did everything legislatively that we could do, trying to raise the issue so the American people would know exactly what was in store for them. Now, I'm on the Ways and Means Committee, and a big part of this big ugly bill came through our committee, all the tax provisions. And we stayed up, I think, 25 or 28 hours straight because they tried to do it at night where it wouldn't have the full view of the public. So we stayed all night and all the next day to make sure that the public had an opportunity to see exactly what it was that they were doing. I think we offered and debated 38 amendments to try and reverse some of the cruel actions that they were trying to impose on the American people. We've been doing a lot in the public space. I've had somewhere between a bazillion and a gazillion town hall meetings and press events, just to let people know what this means, not only in the food space, but the healthcare space, what it does to veterans. This is devastating. All of the research grants that were taken away to do all the good research in the food area, in agriculture, and in healthcare. And in every instance, I've had people from the community with me. So the experts, the people who know what these cuts are going to mean to the American people. And I don't think I can participate in your interview without mentioning, if you have a bill, a big bill, that it truly is beautiful, you don't make the cuts go into effect after the next election. because if it's beautiful, people are going to want that and they're going to vote for it. This was sneaky. A lot of the cuts go in after the election. Some of the most devastating cuts go in after the election. 14 million people will lose their health care, which is also going to, in fact, impact the food area too. And with a $200 billion cut in food programs, that will mean that people will be less healthy and they'll have no health care to turn to. So, I mean, this hits regular people every which way from Sunday.
And Allison, when the Congressman talks about cuts to health care, have you, in your experience, seen that people who have a limited budget and their health care costs go up, do they cut back on their food?
Absolutely. So it's a direct connect. I mean, we've talked to people now for almost 40 years about the impact and the choices that they're making. And so oftentimes the reason they finally end up turning to a place like the Redwood Empire Food Bank is because they've already said, I can't control the cost of my health care. I can't control the cost of my prescriptions. I can't control how healthy or not I am. And so what I'm going to do is I'm going to eat less. I'm going to eat less often. I'm going to skip meals until they finally come to us. And then they say, oh gosh, how could I ever live without? But even then, we're still supplemental groceries. So we're not necessarily everything that every family could ever imagine in terms of what they need for groceries, which is why safety net programs like SNAP and locally CalFresh, that's why those programs are important. It's all just supplemental. It's not like somebody's making it rich off their CalFresh dollars or making it rich off of the fact that they might access, Medicaid or Medi-Cal. It's because they're ill that they're going to their healthcare entity to ask for help.
I ask about the loss of funding to SNAP, or the Supplemental Nutrition Assistance Program.
The overall funding was about $200 billion. And as Allison mentioned, that hurts all sectors. It hurts people who are in need of food. Those are seniors, working people, children, veterans. In Sonoma County, I think about 15,000 people who will be directly cut off from food. So about 7 million people nationally who will lose all food security help that they had been getting. And as we've both mentioned, when that happens, you don't get a healthier community. More people are sick. More people need health care. There's less of that will be available. Less preventive health care, which means when someone shows up at the hospital, they're going to be acutely ill, and it costs a heck of a lot more to treat acute than it does to treat preventive. Right. So this is not good public policy. It's not humane. It's not kind, and it's not saving any money.
No, because there's really an economic impact. And so no different than we were talking about the governor providing CalFood. And so it's California dollars supporting California product and going back into hungry Californians, as it were. In this case, SNAP benefits and CalFresh does the same thing. So you're giving somebody who would otherwise have a hard time making it through the month with their groceries, and they're going back into their local markets to use those benefits. Well, if there's just less benefits, they're spending less money on food, it impacts our local grocers. It impacts the delivery drivers. It impacts those, food manufacturers that are feeding into that system. So I don't know that that's been enough a part of the conversation either, to say even in our local communities, there is an economic benefit that is generated from these hunger relief programs, quite honestly. Right. So if everybody's just focused on even the impact to the individual, it's really important, but it's also to our direct economy that we all rely on and want to be stable. So right. It makes people vulnerable, but also, the local markets.
As we mentioned earlier, there's a number of folks in the agricultural space that had been involved in programs where they could sell their products to someone in the food bank business, schools.
Is there a way for private funding to make up for the loss of these kinds of programs?
Realistically, likely not. We've been really lucky as a food bank that when we've had disasters, so when we had the fires, really the community showed up. Even when we had the pandemic, the government stepped up and said, how can we help? And we're finding that we're in this phase of really dire circumstance to say, well, who's going to be able to show up when the government is what's causing the ripple effect in the safety net services? Because the government's not going to show up, and we can't expect private philanthropy and individuals to be able to make up the difference. We have a $4.5 million difference in our budget this year.
Allison is so diplomatic and so wonderful and kind. Let me put it a different way. No. This is a lot of money. $200 billion. Communities can't come up with that type of money. The fact of the matter is, here at Redwood, we're a lot better off than a lot of our neighbors. Some communities don't have near the philanthropic generosity that we experience here, and we're going to struggle. Those other communities are going to struggle greatly.
Learn more about the Redwood Empire Food Bank at refb.org. I'm your host and producer of this program, Michelle Marques. Podcasts are available at krcb.org/the707. Email topic and guest suggestions to the707@krcb.org. This show is a service of NorCal Public Media. Our president and CEO is Darren Lachelle.